have the LHIN really leverage a lot of the resources, the administrative resources that are in many of our acute care institutions in helping primary care to deliver better results to patients.
I think that we could focus on the challenge that Minister Matthew gave us back in January last year when she unveiled the Ontario Action Plan for Healthcare. System coordination is a big key role, meaning that having someone to help clients navigate the system so they could go from point A to point B without being lost.
So affecting change in the system is going to have to happen in a stepwise way. So our main message is not to allow yourself to get overwhelmed, but to focus on small incremental steps towards change. But doing that continuously over time can be very impactful. And I'm very hopeful that the Health Links initiative will bring planning down to the grassroots level and engage all parts of the system to look for solutions to the challenges we face.
We know from data and evidence that's out there that the ability to wrap services around the patient and access to allied professionals in a team-based environment is really what will make a huge difference in the patient care and especially in the patient outcomes. So really when you look at Health Links, this is an opportunity to look across the entire continuum of care, from acute care right through to long-term care, primary care and rehab, and be able to provide those services in a more meaningful way.
By respecting the relationship that primary care has with patients and families along their health journey.
Working together to better support patients transitioning from hospital to their home in a safe and efficient manner.
Demonstrating continuous commitment to coordinate effective and efficient ways to meet clients' needs.
Working together.
By wrapping services around the patient and providing doctors and primary care providers with the links across the system to do that.
The Central LHIN has a philosophy, and that philosophy is this: together we are better. It is the foundation of what we do at a system level to advance change, to improve quality. At Central LHIN, we believe that we must work together to achieve the highest quality of care for our patients, clients, and residents. And by quality, I mean the right care in the right place at the right time. At Central LHIN, we truly believe that primary care is essential to the transformation that needs to take place in our healthcare system.
Initiatives about improvement have to be about improving the patient and the provider experience. The second is that they add value, the equation of quality over cost. Coming from a reference point of family practice, we see our obligation goes beyond just caring for those that we provide direct service to in our community. You heard the reference to Health Links. You're in a Health Links community. How can you participate and help improve that? Government and government agencies about system improvement. So we believe that starts with your own practice. So part of our goal is to help give you a structure or methodology to help you improve your work environment. What do patients need, and really, really need? We'll give you a few minutes to do that now.
You're probably familiar with the Excellent Care for All Act that was passed in June 2010 in Ontario, a very unique piece of legislation that really establishes our province as a global leader. And some of the elements of the Excellent Care for All that are really interesting speaks to the accountability that all of us have as healthcare professionals in the delivery of healthcare. And I think perhaps most important, the Excellent Care for All really puts people at the center. The person-centered nature of this legislation is pretty powerful because at the end of the day, we're all consumers of healthcare. This act and its legislation are very powerful, and clearly the LHIN is a very important strategic partner in bringing this legislation to life. And certainly hearing the LHIN support for that is really powerful because so many of you today represent that sector.
Use what you have, do what you can.